Just before national lockdown, I convened a meeting of the local lead officers for ageing in the 10 local authorities, really to understand how at a Greater Manchester level we could best add value to the work they were doing, to hear what the needs of older people were and what resources we could find and share.
We were listening to people's experience, what was happening across the city, and we started to really think, how do we ensure that people stay well at home? What do we need to be doing? How do we need to change the story that was maybe coming out of central government? How do we need to make sure that the communications that we're using isn't just digital by default, but is actually more inclusive?
We were lucky because down to the relationship that we've had with the University of Manchester and the Healthy Ageing Group, we were able to combine, I think, the expertise from the academy with the networking and convening powers that we had.
In consultation with the Ageing Hub and other partners, the university decided that we could do something a bit more practical to support people at home and get a paper resource into people's hands as so much information was coming out.
We were getting intelligence and offers of support and need, which would help to shape what this booklet might look like.
I was asked what sort of issues were significant to our residents, what sort of questions they were asking our frontline staff. So we talked about things like helping with repairs, welfare issues and issues of loneliness and isolation.
From partners at the university, it was very clear that there was information that they could share around falls prevention agenda, and that was very much evidence-based. We also had partners at the GM Nutrition and Hydration Programme, and we also had partners at Greater Sport who again had more information on the exercise and how to stay fit.
Some of the content that we supported with is the strength and balance messages. We know that that plays a big part in terms of deep conditioning, so making sure that they were part of the booklet was key for us.
All the people, they knew what they were talking about. So it was good to get information from them.
It's one thing as a policymaker to deliver what we think older people want, but that maybe doesn't reflect what it is in actuality that older people do want.
I just thought this is fantastic because older people, COVID, we are indoors, we were constantly having negative communications via the media, and it was all a downhill. What are we going to get to give us some kind of positivity? And I just thought this was brilliant.
This book is good because it doesn't negate you. This book is like a silent friend.
What made the booklet such a success is the fact that it's co-produced with older people.
The Keeping Well at Home booklet became a World Health Organization case study, which really put us in the position of being an example of best practice globally.
It was really important to us that not only we created the first version of the booklet and we included older people in that, our experts by experience, but then we needed to check that and say, actually, have we done the right thing? Have we included the right content? Does this really make sense to people? And of course, what have we missed? Because inevitably we will have missed something.
Evaluation is critical because in reality, we all live in a bubble. Evaluation is a clean set of eyes.
A lot of the evaluation showed that people really liked the booklet and that they would like other things to be involved in it.
The evaluation of the first booklet gave us a business case for doing the second booklet, and that resulted in printing 140,000 copies of the booklet. It also resulted in being able to produce a video and a talking tips guide.
I was approached by the Greater Manchester Ageing Hub to have a look at the booklet and to look at the content, but to also look at the talking and conversation tips that were a guide for people utilising the booklet, so that if you were a frontline worker and you were talking to older people, then you had pointers, tips, ideas, hints, that kind of thing, in which to introduce both the booklet but also to expand on what was in the booklet.
We needed a couple of translations. I think it was Urdu and Bengali, and we also looked at two other translations in terms of British Sign Language, and the easy read version that came from learning disability communities. But what that enabled us to do was kind of simplify and get to the essence of some of the information. And that then becomes something that you can pass on to other communities where there might be difficulties in kind of comprehending the full, more complex and perhaps even sometimes more technical information.
All of this wouldn't have been possible without a successful first booklet, evidenced by a University of Manchester evaluation and consolidated by a case study with the World Health Organization.
We've got just shy of 1,000 people that we could literally, the books arrived, the envelopes were ready. They went in the envelopes and they went out.
In Rochdale, we've got them into the vaccination centre. So not only do the older people get a jab, which is fantastic, they also get the Keeping Well in Winter booklet.
In Greater Manchester, we started from a very strong position. We had existing relationships with a wide variety of partners that we could easily pick up. We already had partnerships with the University of Manchester, as well as close working relationships with the 10 local councils that make up Greater Manchester. We also were working in partnership with Age UK, with some housing providers and with some older people's groups.
There is an ageing hub and there is proactive work in older people as a priority of the combined authority. That's also helped by having an older people's network, both for Manchester and Greater Manchester, where you can draw on the experience of older people to make sure you're getting it right and you're doing it with people, not for people.
Because I'd been so involved, I sort of had a bit of ownership, I think, of it.
I particularly saw myself as a partner in this, not as a you and them. I felt very much involved and that our contribution was taken on board.
Manchester in particular has a really great tradition of working together across the age-friendly agenda. So, linking people together, bringing partners together so that you've got people from health, housing, social care, the voluntary sector, policymakers all working together to try and make sure that we make Manchester an age-friendly city.
There is a willingness to give up a little bit of an individual organisation or your individual skills to share with other people and to sort of work together.
You're always a little bit worried when you print something like this. And bit by bit, you start picking up information. You see photographs outside sheltered housing projects where people are holding copies of the document. The document is being given out at vaccination stations where it's been said to do so. You get information back from local authorities in parts of Europe and the other side of the world saying this is a brilliant product. Can we adapt it? All those different ways, they count as successes, I think.